A new state of emergency last night. It goes into effect just before midnight last night. It is a new and distinct order to address a new phase in the corona defense and the efforts that we have. And this one will focus again on, as we go along, we're focusing on different situations. The situation with the virus has changed from the beginning to now. As I've heard me say before, we know more about it now than we did then. We understand the need for social distancing, a new term to most of us. And we also know very clearly that those at most risk are the elderly, those in rural areas, those in poorer areas of the state, in minority communities, and when you have combinations of those with underlying chronic conditions, that is where most of the fatalities are resulting. So we are bearing down hard on those. As you know, DHEC began a systematic approach to testing every nursing home in the state. We have, I think it's over 150, maybe more than that, nursing homes in the state, such facilities. And with staff and residents, it's about 40,000 people. And because of that effort, because of that enhanced effort, because of the fact now we have now over 200 places where people can get tested for free, whether they have any symptoms or not. Without pre-screening, they can get tested. Because of the mammoth amount of new testing that we're doing, we feel very much confident that we're on the right trail in the virus. And also, as we mentioned, I think about 3 weeks ago when we began this, our goal was to test 100 DHEC, to have tested 110,000 people in the month of May. We've already done that. And we're not to the end of May yet, and another 110 at least in the month of June. But as a result of that, the positives are going up. And that was something that we expected. But overall, the 28-day average is going down. And that's a good sign, and that gives us confidence that we're on the right track. The emergency declaration does a number of things. It concentrates on those hot spots, on the tracing that are being done of those who test positive, but also it allows us to continue to combine the resources of the state agencies in new ways, usually outside of their own area, to go with this, continue this effort into the virus. Without a state of emergency, the federal funding resources could be jeopardized. As you remember, the Stafford Act, that's the U.S. government, the Stafford Act requires a governor declaration of emergency in order to access those federal resources, mainly money. So that's what we're doing. And we look forward to working very much with the General Assembly to get all these things done.